This procedure is where the healthcare provider prepares for ampules by using syringes and preparing the right amount of medication. Its purpose is that it absorbs more quickly than oral medications because it directly enters the body tissues and circulatory system as it injects. The equipment needed for this procedure is a syringe, gloves, gauze pad, vaccine vial, vaccine carrier, and VCG vaccine ampules. For the considerations, it is important to check the expiration date on the medication, ensure the right amount of medication, and ensure the sterility of the syringes being used. After the procedure, document the amount needed for each medication being withdrawn. Gather all necessary equipment. Always keep the diluent cold by sustaining with BCG vaccine ampules in the refrigerator or vaccine carrier. Check the expiration date of both the BCG vaccine and the diluent. Check vaccine vial monitored sticker to assess potency of vaccine. Wash hands thoroughly or use alcohol for sanitation. Get the diluent. Tap the stem of the ampule or twist your wrist quickly while holding the ampule vertically. Wrap a small gauze pad around the neck of the ampule. Use a snapping motion to break off the top of the ampule along the scored line at the neck. Always break away from your body. Attach filter needle if there is any. Remove the cap from the needle by pulling it straight off. Using a 1 ml syringe fitted with a long needle inserted into the ampule, aspire 1 ml of saline solution from the opened ampule of diluent. Use either of the following methods. First, insert the tip of the needle into the ampule, which is upright on a flat surface, and withdraw fluid into the syringe. Touch the plunger at the knob only. Second, insert the tip of the needle into the ampule and invert the ampule. Keep the needle centered and not touching the sides of the ampule. Withdraw fluid into the syringe. Touch plunger at knob only. Wait until the needle has been withdrawn to tap the syringe and expel the air carefully by pushing on the plunger. Inject the 1 ml diluent into the ampule or vial of freeze-dried BCG. Thoroughly mix the diluent and vaccine by drawing the mixture back into the syringe and expel it slowly into the ampule several times. Return the reconstituted vaccine on the slit of the foam provided in the vaccine carrier. Perform hand washing.